If you are planning your hair transplant and you are doing your research about the techniques and you are confused about FUE and FUT hair transplant, in this video we are going to simplify the techniques of FUE and FUT hair transplant and graft harvesting by these techniques for you. There is a lot of technical information made simplified for you to understand. We request you to please keep watching this video till the end so that you know the latest advances in both the fields also. I am Dr. Satya Saraswat, a gold medalist plastic and cosmetic surgeon and an American board certified hair transplant surgeon, and in this field of hair transplant for more than 17 years and have done thousands of hair transplant and have trained almost 90 doctors from world over in the field of hair transplant at our hospital, Saraswat Hospital, Agra. Do like the video and subscribe to our channel if you want to know more about these informative topics. Now, before going further, we will discuss in brief about what is FUE and FUT technique. In FUT technique, we take a strip of hair-bearing skin from the donor side, that is the back of the head, and then we close the remaining area by stitches, and then from that strip we harvest the graft by slavering and cutting the grafts or harvesting them under microscope. Whereas FUE technique, we take out individual root from the back of the head by taking it out single individual unit using a punch and a machine. So this is the basic difference between FUE and FUT. Now we will discuss the advantages and disadvantages of both the techniques with a lot of recent data and information and advancements in both the field. If you feel that this content is useful for you, do hit the like button. Now we will discuss the advantages of FUT, which many clinics do not discuss nowadays. So there is a safe donor area, which is a well-defined small area at the back of the head. This is a limited area. When you do a transplant or a graft harvesting by FUT technique, we ensure that we are not going away from the safe donor area. We are not harvesting the grafts out of the safe donor area, which is the real and very often criticized negative point about the FUE. If the grafts are harvested from the safe donor area, they are going to stay for a very long time at the area where we are doing the transplant. This is the primary advantage of FUT. Also, since we are taking out the full thickness of scalp skin, the grafts which we get have a lot of good fat around it. These are known as chubby or robust graft. So the hair growth will be poor if the graft do not have a good content of fat. They grow from the fat. So the FUT yields a better result in terms of better growth of the grafts. Another advantage of FUT is that we can do a long hair transplant easily using the FUT technique because we can harvest the long hair grafts in a strip, which is quite easy. It's also useful in African and Afro-American scalp, and there are people or patients who have a very loose scalp. In these patients with loose scalp, FUT is better than FUE because it takes the advantage of the looseness of the scalp. If you are looking out for hair transplant and are confused about the techniques you have to undergo for a hair transplant, you can write down in the comment section below and we will revert back to you as quickly as possible. Now we will discuss the disadvantages or the criticisms of FUT which many FUE clinics do. The first criticism of FUT technique is the scar which comes after FUT. Now I want to tell you a very important thing, that scar will be poor if the technique is done poorly. If the limit of the strip, the length of the or the width of the strip is exceeding more than 2 or 2.5 centimeters, especially in a tight scalp, then the scar will stretch over a period of time and give you a bad scar. But if a doctor is doing a trichophytic closure and they are well versed and practiced into that, experienced with that, the scar will definitely not be there, as you can see in many of our patients in whom we have done a FUT technique. A very important thing or a disadvantage of FUT is that the transaction which happens at the back end when we are slavering the strip or harvesting the graft from the slivers, that transaction which happen is permanent. Not many clinics talk about this very important part. If our technical staff accidentally cuts the grafts, that transaction is permanent and those grafts are lost forever. As we all know that the roots are limited in number and any transaction of the grafts is a very painful thing for us. So this is very important, that the transactions in FUT at the back end are permanent. It is quite difficult to do a FUT technique in a white or a grey haired person. It is possible but very difficult. We have to color them, then the dye should go inside the roots and it should be visible. But as a layman or a thumb rule, it is quite difficult to perform FUT in a white or a grey haired individual. And the last disadvantage is that FUT is technically very difficult to perform as compared to FUE. There was a time like 10, 15, 20 years back when we started doing our hair transplant. And those days, FUT was the gold standard of hair transplant graft harvesting technique, and almost all the doctors were well versed. But with the advent of FUE in last 1.5 decade, the number of FUT surgeons are decreasing. So there is right now a dearth of doctors who are technically performing FUT effectively, safely, and with the skill and expertise needed, as it is a long learning curve and is technically difficult to perform. If you want to discuss your individualized case with us and want to know the solution for your hair loss problem, you can call us at the numbers given here below and we will try to reach out to you at the earliest. Now coming to the advantages of FUE technique, the primary advantage is that if we are doing an irregular extraction from the safe donor area, a wide area, the scarring is not that obvious, especially if you are keeping your hairs a bit longer. Also, FUE is an easier technique to perform in white and grey hairs and is easier to perform FUE in a person with a tight scalp. So this has to be individually analyzed by a doctor to see which technique suits you personally. This has to be assessed by the doctor. Also, if there is a transaction of the grafts in the donor side by FUE technique, it is now well known that transaction is not permanent in majority of the grafts, as most of them will grow back again and it's not a permanent loss of your hairs from the safe donor area. Also with FUE, we can harvest body hairs, especially the beard, chest and back and all those hairs. It can be only harvested by FUE technique and not by FUT technique. And the last and crucial advantage is that it's technically less challenging to perform a FUE technique, as you need a small set of instruments, and that is why we are seeing a lot of clinics offering exclusively FUE technique, because it's quite easy to perform and has a lesser learning curve as compared to FUT. If you want to know more about hair loss treatment for men, you can click on the video given in the link above. Now coming to the disadvantages or criticism of FUE, the primary disadvantages of FUE is that many a times the clinic or the doctor may transgress the safe donor area, as it's not a well-defined line or a demarcated line. So the harvesting may be done out of the safe donor area, and these hairs or these follicular units will have a smaller life and they may shed off quite early, even in a couple of years post-transplant. The second primary disadvantage which we are seeing nowadays is over harvesting of the grafts from the donor area by FUE technique when a person goes for the repeated sittings, especially if that clinic or a doctor has a very high transaction rate. So if you get a transplant done here, then second sitting after a couple of years, then third sitting, every time the donor area at the back is thinning out over a period of time. So this is a valid criticism, and we are seeing a lot of patients nowadays who have these kind of problems, and this can be resolved by scalp micropigmentation technique. If you have had an over harvested donor area and there is a lot of visibility of your scalp, then you can click on this video above given in the link, where you can see how scalp micropigmentation can help in these patients with over harvested areas. There are some unresolved issues about FUE which are discussed by the doctors in almost all the conferences. The primary ones are, what is the ideal punch size? Nobody knows it, because if you go with a smaller punch size, there is a higher transaction rate, although the scarring is less. And if you go with the higher size of the punch, then the transaction is diminished but the scarring increases. So this is one. Then what is the ideal speed of graft harvesting or the rotation per minute? What kind of punches should be used? They should be cylindrical punches, elliptical and trumpet punches. A lot of punches are there, and these are the kind of unresolved issue about which still there is some consensus to arrive at. And you have to know that a lot of advancements are happening every annual basis we see that a lot of advancements have happened in the field of FUE, especially the techniques and the machines by which we harvest the graft. Now there are window punches through which we can harvest the long hairs. Now there are trumpet punches by which we can harvest Afro-American hairs. So these advancements are happening, and still the technique is under refinement. Now coming to a conclusion or a sort of winding up of this video, what is crucial is that the doctor should be well versed with both the techniques. If a doctor is exclusively doing either FUE or FUT, they will try to sort of pitch in or force a particular technique for you which may or may not be suitable for you. But what is important is the doctor should be well versed, the team should be handling the grafts nicely, and you need to have total transparency and clarity about what kind of results you can expect. So this needs a customized planning for you by the doctor, and this has to be done on a customized, individualized basis, and this should vary from person to person. Not the same cap is going to fit everybody. It needs a specialized planning for you. This is very important. Do share and subscribe this video with your friends and colleagues who are planning out hair loss treatment, and this is a very useful information for all of you. If you want to see a patient testimonial or our results, how we are doing our hair transplants and planning them, you can click on the video on the left